Recently, I had a patient who was getting down from the stairs of a flight which he traveling from Delhi to Bangalore, and suddenly he slipped on the right side and he couldn't grip these railings for a few seconds. And when he got into the bus of in the airport, he fell unconscious, and people found him had an epilepsy attack. That is called seizures or fits in a common man term. He was just 42. So he never had a history of fits in his life. So when somebody has what is called adult-onset seizure, we always suspect as a neurosurgeon, there is something brewing within the brain, something growing there. Either it could be an infection, or is that we call cysticercosis, which is an organism which will be seen when you grow vegetables or somebody eats the meat, in infected meat, it enters into the brain, or it can be bleeding within the brain. So he was brought into our emergency. I was called in. When I spoke to him, he was calm. He had a mild hand weakness, and because he has come directly from the airport to the hospital, he was completely perturbed, jittery, and as usual, when you see a doctor, everybody gets scared. But I made him comfortable, telling that nothing will be the major. I took his history, then I told him, it is a small problem. You are so lucky that as of now when you came in, there is nothing problem with you, but we had to look in, why did you have a brief loss of consciousness and a kind of a fits we call, which he was not knowing he had a fits. Then I did an MRI. To my surprise, there is a large tumor within the brain parenchyma sitting exactly in front of the hand area, coming into the right side of the brain. And I told him, I gave him medication, sent him home, saying that take this medication. I made him walk in the emergency itself. I told him take the medication, nothing of the great concern, wait for 2 days. On the third day, come to my outpatient along with your family. We will discuss about the rest of the report. So patients were very happy that he could walk in my emergency. I conjured him, if he takes that medication, he will not get the epilepsy. And if any problem, to contact me irrespective of what time of the day. So he was very convinced that he can go home. He was made to drop to his house from my hospital. And on the third day, when the family came in along with him, I made him comfortable, explained his brain pictures, and he understood that there is something growing on. To my surprise, he was least perturbed. And I asked him, why you are least perturbed in spite of the tumor? He said, doctor, you said there is a problem which is solvable, and you made me smile on the day one. I'm not at all bothered, I'm with you. So I was convinced that my patient can understand exactly the way I want him to smile and take the things as it comes in. He was very, very comfortable. So is his wife. So I explained them the need of surgery, why we had to do the surgery, and believe it or not, he had a surgery. He was, we did a surgery when he was completely awake. We did what's called awake craniotomy. I removed the complete tumor. We made him walk on the same day when he was come out of the anesthesia within less than half an hour. It's a local anesthesia. And I sent him home in 2 days. And his biopsy report came as grade 3 glioma, which is easily treatable, which requires constant relationship between me and him so that he will do a normal life. And within a month, he was back to his work, and I'm having him under his follow-up with newer therapies which we'll be looking for. And gliomas are the commonest tumors of the brain when diagnosed early and treated beautifully with the newer technology of awake craniotomies. Doing the surgery when the patient is talking will not produce any problem in the brain, including his weakness, which many patients will be thinking about it. Patients in the ICU, on the ventilator, none of these things will happen, and it can be easily taken care when you visit a center called Aster Whitefield Brain Tumor Center. We diagnose, we'll treat, and make sure the next therapies will be done in a single center, irrespective of getting disturbed in any place. It is a teamwork where the radiologist, neurosurgeon, neuroanesthetist, neuro-oncologist, radiation therapist, every come in together to make one patient better. You would rarely find any other place except in the Department of Neuroscience at Whitefield, Bangalore.